Hi, everyone. So, thank you so much for joining today's event. Very good evening to all of you. I'm sure majority of you would have seen or listened to podcast, and at least some of you would be fans of such programs. So, podcasts are generally used to learn about a topic, to discuss a current issue, or many for entertainment purpose. So, FCPI has launched this podcast series with the aim of discussing different aspects of clinical pharmacy, which would actually help participants to get a flavor of the life of a clinical pharmacist. So, with that brief introduction, I would like to welcome each one of you to the very first episode of FCPI podcast series. So, I'm Rita Namputri, and I'll be the host for today's episode. Today, we'll be discussing about various aspects of working as an infectious diseases clinical pharmacist in India. I would actually like to encourage all of you to stay with us until the end of today's episode and to share the key learnings from today's episode on social media and tag us. So, without any further ado, let me welcome the guest for the first episode of FCPI podcast, a very dear friend and FCPI's president, Grace Mary John. She holds multiple titles at Believers Church Medical College Hospital at Tiruvalla, Kerala, including that of an infectious diseases clinical pharmacist, head of clinical pharmacy department, assistant director, and assistant professor in the Department of Pharmacology. She is the first clinical pharmacist from India to be American board certified in infectious diseases. She is a member of the Society of Infectious Diseases Pharmacist International Task Force and Education Committee. She is the ambassador for Board of Pharmacy Specialties and also an alumni of the International Ambassador Program by Society for Healthcare Epidemiology of America. So, a very warm welcome to you, Grace, to today's podcast. Thank you so much for accepting our invitation and joining us.
Thank you, Vrinda. Thank you so much for. I must really appreciate your effort in starting this, podcast because in India we don't see much of podcast, but in abroad you see a lot of these things that go around, and so many people get a chance to get inspired and to learn a lot from these podcasts. So hats off to you for coming up with this idea to start the podcast, and it's a very proud privilege for me that you called me first for the first episode. To represent both FCPI and clinical pharmacists in India and infectious diseases. Thank you so much, Vrinda.
All right, so let's get started. So, like you said, the aim of today's podcast is to have an informal discussion between us, but I'm sure that it will have a lot of educational points to the participants who are aspiring clinical pharmacists from India. So, let's rewind back about, say, like 14, 15 years when you have completed your 12th standard and you are in the point where you have to decide on which career path to choose. So what actually drove you to take PharmD as a course? What actually motivated you to take that step? Because so we are among the first few batches of PharmD from India, and when we enrolled for the program, hardly people knew about PharmD. So I'm actually very curious to know what actually motivated you to join for this program.
Uh, Thank you so much for that question, but let me be very frank with you because the motive with which I first got into PharmD might not be the exact correct one that every person should take PharmD as their first choice. So, while like you said, when you are doing your 11th and your 12th standard education, you're always thinking as to what next. Okay, and you take biology if you want to go into the medical stream, and you take the computer sciences and mathematics mainly to be on the engineering side. These were the two major things that I mean, in my time it was these two basic things, but economics was also there. So definitely, especially being from Kerala, medical education is something that every family look forward to. And similarly, I also joined this prestigious school that is known to train people to get into medical school or into the IIT, the good engineering school that is in Kanjirapalli. There's a college called as St. Anthony's School, famous for all these things. And definitely the reason, initially it was always about medicine. I wanted to do medicine because we all respect doctors, and we wanted something very similar to be, I mean, we wanted to have that respect, to have that love they have for the profession. And while we were studying, while we were doing our coaching for the medical entrance exam, uh, my mother got a paper clipping about, we have in newspaper that regarding new careers that come, they publish such data, right? So in one of the interviews, it was written about PharmD. It has mentioned PharmD as a new career that is opening out. And my mother got this clipping, and they inquired about it as to what PharmD is and all that. And my father and my mother, they tried to find out from abroad, like those who are working abroad, about how PharmD is, because it was not there in India. And at that time, and they all got the great feedback that it is a good course to choose. So that's exactly how I even got into thinking whether to take PharmD versus MBBS initially. And this is the time when I have not even appeared for the medical entrance exam. So through that, I think 6 8 months in the 12th standard, towards the end, before even writing this exam and everything, um, what happened was that I got to know that abroad, if you go, there's so much opportunities for you, waiting for you if you take PharmD. Major one, 6 years. It's a integrated postgraduate course, right? So when you compare MBBS, 5 years of MBBS, then you have to take 3 years of MD. But when you compare to be a postgraduate, but when you compare being a PharmD, 6 years packed into this program to become a postgraduate, and you get the tag of the doctor. So whether I don't know what to say, like for the wrong reasons might be, but this is how I got into PharmD. Because and the major reason was that initially there was discussions regarding how PharmDs can prescribe medicines. The catchphrase was, I mean, most like this: the doctors diagnose, the PharmDs prescribe.
Exactly. I remember that.
So this is why initially this thought came. Then it's like, okay, PharmD looks so much superior to MBBS. Why break our head on this medical entrance exam? Even if you don't get it, you usually repeat for the next, sitting.
Yeah.
So why go through all that hurdle when you can straight away go into the doctor thing with prescription rights and things like that with good pay? All these things were the reason why I got into PharmD initially, and obviously going
Right.
abroad.
Right. So, okay, those were your reasons to get into PharmD. And once you started doing PharmD, and now I think you have about 7 8 years of experience as a clinical pharmacist. Was there any point along this line where you actually regretted taking PharmD? Because I'm asking you this because I talk to a lot of students, a lot of practicing clinical pharmacists who still regret them choosing the course PharmD. They say that it was not worth it. Spending 6 years, not having sufficient opportunities. There's a lot of complaints that I hear about it. So I'm actually interested to know whether any point in your life where you actually regretted and you felt that maybe this was not my cup of tea.
Again, to be frank, multiple instances where you actually regret taking PharmD, not just while doing the course, after completing the course as well. So I think this is something that I always try to share with the students who listen to me also, because it's not uncommon for you to think about, oh, I shouldn't have taken this course. This doesn't seem to have good opportunities. It doesn't seem to, have like a promising professional career laid out for you. All these things will happen. All these thoughts will come to your mind, especially I think for all the clinical pharmacists, this comes true, especially when you start your clinical rotation. Till then, it's all about the college. It's all about your friends. You have a good time with your friends. You are not worried about much, no, because you are in the process of learning. But as soon as you start your clinical rotations, that's when you go around with the doctors. And if not if mostly, we don't get that recognition saying, this person has come, okay, let's give this task to them. We don't get that, right? we ourselves don't know what we are supposed to do. We ourselves know that we don't have the
That's
knowledge to tell them, okay, sir, this is what I think it should be done. I mean, we don't have the courage, and we don't have the soft skills to speak to the consultants. So we are always at the back of, the usual team that is going for rounds, always at the end, because our opinions doesn't matter. It's just that we are like, we feel like an added burden to the team. All these things were there, especially because I joined family in 2009. It was a second batch in India. The first batch was in 2008, which were my seniors in my college, in PSG College of Pharmacy. And second year, so this is a second batch. And obviously we didn't have much to, get from our seniors as well, because they were also going through the same thing. They were also confused as to what to do, how to make an impact. It was all about making an impact during your clinical rotations. So whenever you are treated, not mistreated, but you feel that you don't feel get that importance, you feel that your
inferior.
opinion doesn't matter, that's when you, oh, what was the point in taking this whole thing? If it doesn't give you that satisfaction that you've done something for the patient or to the doctors, or in any way you're unable to contribute to the, the pharmaceutical care, as you can say. So every all those times there will be regrets. And now that is during the training, and the same thing will happen in your career as well. When you start your career again, see, I always tell them, I will always tell my interns, whenever I get a chance, that see, when you're intern you can afford to make mistakes because you are learning, right? But when you become a staff, when you are a clinical pharmacist, you can't afford to make a mistake, because it is a responsibility that you've been given as a staff, that you have to take care of certain things. And during that transition also, again, if you don't have a good hospital training, fortunately for me, PSG, like I said, I trained in PSG. It was a good hospital with a bunch of very good doctors. Not that every posting that we had was so excellent or anything, but there were like three or four postings that I really enjoyed being with them, because they always, gave us presentations to do, make us the dosing adjustment, all these things they used to give us. So when you transition from there, certain things that you can do, but certain things that you want to do, but you don't know how to do it. So at all these stages is where, your regrets start coming up. And I think my director is the one who noticed that, family is I mean, the director of the Believers Hospital that I'm talking about, the hospital that I'm working. He is the one. Once he got to know me better, he used to tell me, if I knew you in your 11th or 12th, I would have sat with you with a stick in my hand, make sure that you become a medical doctor, because, why did you take pharmacy? You should have taken MBBS. This is what he used to tell me. Very, very sincerely, he used to tell me. So that also, even to an extent that even after getting married, my director told my husband, why don't you send her for MBBS? Let's try. We
Oh,
can still do it. This is what. So at that time also, I used to, okay, maybe should I? All these things used to happen. But as the career progressed, as there were so many more opportunities, I have no regrets right now. I am very happy what, as clinical pharmacists we could achieve so far. And 100%, like, now I tell them, if I would have taken an MBBS degree, I would have been one of the doctors that you see around, you know nobody would have known, or no, I mean, you wouldn't have been able to make an impact, or stand out. But when it comes to
interested.
comedy, because you are a pioneer, you are in a way, you know getting the way ready for the people who are coming just behind you, right? So that gives a lot of satisfaction to you. So right now I actually do not regret taking pharmd. I'm actually very proud that I took pharmd, because everything finally came together. And I think the life's purpose, if you look as a picture, as a whole picture, to me it makes more sense now. And I would have actually regretted if, I mean, in a parallel universe, if you could see
Yeah,
how you
yeah,
do
yeah.
as an MBBS person, how you do as a PharmD, I think the MBBS person would ideally, I mean, would regret about not taking PharmD. It's the current scenario right now at my hand.
Thank you so much for sharing that. Actually, I think it will resonate with a lot of clinical pharmacists and pharmacy students because this is a common concern. Because probably because we don't have the right orientation about the course, we don't have people to guide us and to tell us what is it that you can do as a clinical pharmacist in India. And I also think that there's a lot to do with the kind of training that we got because, like you said, in Kerala or in India, medical profession gets a lot of respect, and pharmacy is seen. I mean, pharmacists are seen as people who dispense medicines. Even after all these years, that is the baseline concept of a pharmacist in India. So I think that kind of a what do you say orientation is also partly responsible for the concerns that pharmacy students have, budding pharmacists have in India.
I think I
So
should
that actually,
add to that,
yeah, go
Vrinda,
on.
even now, people try calling, oh, DPharm, right? This even now it happens. Okay, earlier it used to happen every single day. Now
Every day,
I'm
every
used,
day.
I'm so much used to it. But even now I hear it here and there, like oh, DPharm, right? This thing is also there. And like you
Yeah,
said, the clinical orientation. See, when you are given to the clinical rotation to the clinical team, the physician team or the team that you're going rounds with, the physicians, they know how to train their house surgeons.
exactly,
But
exactly.
they don't know what to entrust us with, right? They don't know what to give us,
Absolutely.
what to expect from us. And ourselves, our teachers, because of the lack of clinical training, they're also unable to. I mean, now it's becoming more and more refined. But at that time, nobody had any clue as to what we should have. The role was never defined at that time.
Yeah. I remember when we started going for clinical postings, there were a lot of doctors who came to us and asked, what is it that we are supposed to do with you? How can you actually contribute to patient care? And we also didn't have a clear answer because, like you said, we always walk behind the doctors thinking that, okay, they are the superior ones. Let them lead the way. And we are there as what do you call innocent bystanders behind them. But I think that whole idea needs to change. And like you said, pioneers like you are creating that path for upcoming batches of pharmacies and showing them what is it that we as clinical pharmacists can do to contribute to patient care. So that actually leads to the next set of questions or discussion points, I would say, where I want to actually talk to you about how is it that you created a post for clinical pharmacist at Believers? Because, like you said, you were one of the very first batches to come out from India, pharmacy graduates to come out from India, and I believe when you joined Believers, there were no other clinical pharmacists there. Is it correct to assume? Yeah.
Yes,
So,
yes.
what were some of the things or what were some of the steps that you took to create that post for clinical pharmacists there?
All right. So, continuing with that journey through my PharmD, one thing that happened, like I said, initially the reason why I took PharmD was to go abroad. Okay, there was no doubt that I wanted to go abroad. But during my fourth year, my father passed away because of a massive heart attack. And at that time, see, in our fifth year, we have this PSC has a collaborative effort with the Toledo University in USA, where you can go for student exchange program. So till my fourth year, like I was always in the first three ranks, and I knew that I always had that chance if I asked my teachers to choose me for a student exchange, because I think two or three people can go. I knew that definitely that chance was there. I was mentally preparing myself for going towards all these things because I wanted to go abroad. So when my father passed away, I felt that I should be with my mother. So that's why instead of going abroad, I thought I'll stay back here. And this hospital, Believers, is like it's quite nearby. It's only 40 minutes from my home. So that was the initial punch where I felt I should uh, stay near my mother. Is that personal thing that happened. And at that time this hospital is just being built, not even first year, it is just going into the first year of it's from the initial start. And so I got to know that this medical director, our medical director, Dr. George Chandy Matitra, He was the former director of CMC Vellore, and I sent him a message during, I mean, message in the sense mail during my final, I think, 2 months of PharmD education, saying that, sir, I would like to get an appointment with you to discuss regarding this, because I knew that they're 100% they will not be opposed. So that was the initial thing that I did. And as soon as I completed my course, and he responded in a very, very positive manner, saying that, oh, that looks, I mean, it sounds like a very interesting post to me. Okay, let's meet on this so and so date. And I came and met him here. He had no idea about family. Okay, so I always say that he's the person behind my professional existence. I would call that existence. My professional existence I owe to him. So he took that giant leap uh, by taking me in as the first clinical pharmacist for believers. And at that time, during the HR interview and everything, my HR had told me that, okay, we'll take you, and after 3 months, we'll assess how you perform, and based on that, we'll decide as to how this program should go on. And that was the time when NABH, we were trying to get the NABH accreditation and all these things. So I was preliminary posted with the pharmacy team, but I was given all the freedom that I needed. And uh, the pharmacy head was one of the surgeons here, and I was introduced to him. Like I said, how doctors don't know what to do with us. When I first met him, he was like, Grace, I have no idea what PharmD is. So you tell me what I should do with you. Okay, this is a person who's asking a fresher what he should do with, I mean, what I should do with my career. So I told him, sir, first thing obviously is that you post me in a specific department. And from there on, I'll try and make all these things that I claim that I can do. Then he said, you yourself choose the department, which again was a big thing for me. So I said, okay, sir, general medicine has always been my thing. I need general medicine, and I'll take ICU as well. So in the morning times, I used to go with rounds with the general medicine team, and in the afternoon, I would visit the ICU patients, and that's how the initial thing started. And during my internship, during my 4th year, during this clinical rotations, again, during that internship, medicine always, general medicine team, one of the doctors asked me to prepare a presentation on IV to parenteral conversion of antibiotics. Okay, that was an entirely new thing to me at that time. And I started working towards it, started studying about it. So antibiotics in that way was, somewhere it was slowly getting incorporated into my career. And then again, being a clinical pharmacist here, the first thing, the easiest thing that I could make, I could make amendments, I could make changes, was the creatinine clearance based dosing, the renal dosing of drugs and antibiotics. Almost all antibiotics have that renal dosing. So these are but to the doctors, it was like, oh, such a thing is there. We didn't know all these things. So small things. Actually, if you look back, these were the minor things that happened, but gave so much importance to you, so much impact to your career. And even the drug interactions, there was a lady who was admitted whose sugar was going up high and high, and there was nothing the doctors could, they were keeping on increasing the insulin. She had CLD, she had arrhythmia, she had RHD, she had psychiatric disorders, so many drugs. So my physician asked me, Grace, could you just see if there's any interaction for this patient? And when I wrote down the interactions, you will have a list of interactions. One thing that I could find out was that quetiapine was one drug that came common with, the effect of hyperglycemia with many other medications. So I advised, why don't we try change this drug? And the next day, I don't know whether how many will believe, the next day when they stopped quetiapine, the patient went into hypoglycemia. So that again gave like so much importance, like, oh my God, oh, she cracked this. We couldn't. So these small things really helped. And after this three months, and the one thing that I don't know who told me, from day one onwards, I was documenting things, because they don't know what to do with me. But I was documenting things as to what all things I did, what all medication errors found, ADAs reported, or clearance based dosing, everything I wrote down. But by 3rd month, my director came and asked me, Grace, how you been doing? Can you just tell me what you've done for the past 3 months? And it was already ready with me, because I had the documentation with me. I had to put it in one document and print it out and give it to him. And obviously the feedback from the physician, my team, my physician team also really helped. And that's when he said, I feel that there's a great opportunity for PharmDs because you know the clinical stuff. Okay, you just need a little bit of tweaking with regard to taking patient history and getting more towards patient care, because you know some of the drugs as well, you know some aspects of the drugs as well. So if you are given a bit of training, I feel that you could do much more than what you're doing right now. So that's how the whole journey of clinical pharmacy started in Believers. And right now I can proudly say that there are 64 clinical pharmacists posted here in Believers who are working clinical pharmacists, who are paid clinical pharmacists. And I know in Kerala that might be the highest number currently.
Yeah.
I can assure you they're all very happy with what they're doing because we give that initial clinical training. Whatever lacunae we had in our uh, curriculum, it is all we are trying to cover up so that, you know, when it comes to a patient, they are very ready to take on that patient and give
Yeah.
whatever is expected of them.
I think there are a lot of takeaway messages from what you just said, because we still hear clinical pharmacists who are just starting their career saying that we don't have opportunities in India. Uh, there is no recognition for us in the clinical side. We are not paid well. There are a lot of complaints. So I think we as pharmacists actually need to take that first step. I strongly believe that. Like you said, even your hospital didn't know what clinical pharmacists could do, and it was your initiatives and that initial push that you gave that actually helped to employ all these 64 clinical pharmacists in your hospital. So I think that's a key message to the participants who are listening as well. If you feel that you are not, I mean, the hospital is not recognizing your efforts, like Grace said, please document what you're doing and show it to them. Say that this is what I did, this is the impact that I've created, because that actually gives a lot of recognition. And I always say to everyone, please publish your results. Whatever you're doing, publish it so that others can read about it. Your hospital will know about it. Doctors will get to know what clinical pharmacists are doing. It will improve your recognition and the recognition of the profession as a whole. So,
Brenda, I forgot. I think I should add one small bit of a story as well to this initial part of
yeah,
Believers
yeah, please,
journey.
please.
But in my medicine team, there was a senior resident, who used to tease me on a daily basis, like, "Oh, I should have taken PharmD. I could have just wanted like you." See, this is when you are being a clinical pharmacist. I know he's teasing me, and every day. It's not just once in a blue moon. It's every day. He used, whenever we are going to have coffee, he used to, I should have taken PharmD. It was so easy to take PharmD. This is something, and it in a way it kills you inside. No, it slowly kills you inside. And one day I was, for some reason, I was pissed off, and on top of that, when he said this, I just looked back at him and I asked him, "See, when you completed your MBBS, did you know everything?" Then he was like, "Oh my God." After that, he has never asked me that again. But later, again, when my director in plan to, you know, increase the number of people in the clinical pharmacy group, initially he took 15 more, just in addition to me, he took 15 more. At that time, he gave me the opportunity, like he told me that I want you to be with me. With he's a gastroenterologist, he's a hepatologist, so he said, I want you to be with me with the gastroenterology team. And initially I was quite hesitant, but later I thinking that he's a director, I will just go whatever he says, I'll do it. So I moved from general medicine to gastroenterology at that time. And when I moved from medicine to gastro, I could feel that difference. For every each and small thing, they would call me, Grace, how to do this, how to do that. All these calls I used to get. And then there was another SR who used to tell me, we were scared to write a drug when you were there in our team. Now we feel so much relief that you're not there. We are happy we can write whatever we want. But when you were there, but see, that is the impact that you're having. They
Exactly,
won't say it
exactly.
out loud when you are there. But the
Yeah,
moment you go somewhere else, then all these good things happen. So in a way, those small things will, give you that joys of your
absolutely.
profession.
Absolutely. Yeah, I would encourage all the clinical pharmacy students, interns, and clinical pharmacists to actually uh, put your best efforts during a clinical posting and to give your 100% during the postings, and talk to the clinicians what you feel is not, maybe there's a drug interaction, there's a dosing error. Don't hesitate to talk to them thinking that you might be wrong, but talk to them in a very professional manner, and not like imposing and pointing out their mistakes. So all those things matter as well. So yeah, thank you so much for highlighting those points, Grace. So I think since we are running out of time, we'll quickly move on to the main crux of our discussion today, that the infectious diseases pharmacy career. So I would like to actually start with asking you why you chose infectious diseases and not any other specialty. So you told me that you began your career in general medicine, then you moved to gastro, and finally you are in ID. So I'm really curious to know how that transition came to ID, because I'm right now a research pharmacist, but when I started working as a clinical pharmacist, I ended up in antimicrobial stewardship by chance. So it was not by choice that I ended up here. I was really scared of learning about antibiotics during PharmD. It used to really scare me out. I always used to get confused with the mechanism of action, dosing, ADR, everything used to confuse me. So I never, in my wildest dreams, I never thought that I would end up in a career in infectious diseases or antimicrobial stewardship. But when I got the clinical posting, and when I got an opportunity to work in this program, that is when I developed this interest in stewardship. And I felt that, okay, this is my career and this is where I want to work in. But I'm actually curious to know how you landed from general medicine to gastro to ID.
Like I said, IT was there from the internship. It was ID in the sense antibiotics especially. It was there from the internship. I was always, it is the easiest. Like I said, the dosings are the easiest thing to do. Then you slowly, that dosing alone is not, it's not the requisite of being an expert. You need to know the kinetics. You need to know the spectrum. You need to know the bugs. So during your clinical practice, you get all these cultures and things like that. And like I said, initially I used to work in ICU as well. So in ICU also you get a lot of these resistant bugs, these difficult choices as to what to do, where to do. And I think being an initial clinical pharmacist and being initially the supervisor of clinical pharmacy, a lot of things were entrusted to me to take care. I mean, like one example that I can give you is that to formulate the antibiotic policy for the hospital. The other example that I can give you is uh, the colistin dosing changed. There was one position paper that came based on the steady state concentration, how to dose colistin rather than this 3 gram Q8, 3 million units Q, 8H, and 4.5 BD. There was specific guidelines. So I started preparing all these documents, and the thing was, I always felt inadequate in my knowledge. I always felt that I didn't know much. So slowly I started to learn microbiology, clinical microbiology, about E. coli, about Pseudomonas, Klebsiella, Staph aureus, Enterococcus, and obviously the coverage. So I use the Sanford guide a lot to understand the coverage, specifically like what is the difference between meropenem versus piperacillin in coverage. Like I know that now piperacillin is actually broader when you compare to meropenem because it covers the Enterococcus part as well. And like all those nitty gritties initially, that is the basics, right? That is the basics of the initial thing. And being in gastro, like I said, I still once a week I do practice gastro because I love gastro. I love talking to the patients, especially the cirrhosis patients. There's so much you can do towards them. But always my calling was towards ID. Uh, that I felt it. So somewhere along the line, I told my director, because he was the head of gastro at that time, um, and I told him, sir, I think I need ID somewhere along. I have to take ID. And then what happened was that in 2017, the physician with whom I used to work, uh, we went for the first SITSCON, the Clinical Infectious Disease Society conference in 2017. That was in Nagpur. And I was actually, just swept off my feet when I went there, because whatever they discussed just went above my head like that. I couldn't comprehend the things they were talking, so high funda things they were, talking, the guidelines. The only thing I could make out was regarding the carbapenem resistant organism, which drug to use when it Acinetobacter, which, because that is something that you see on a daily basis in your practice.
Yeah.
The other things never made any sense to me. So that's when you get the biggest chatka, saying that, you don't know enough to understand all these things. You need to train yourself. And I remember very well, on my way to this SITSCON, while we are going to the airport, my physician, my ID physician, Dr. Jansi, she told me, Grace, now that you feel that ID is your passion, I think you should stick on to ID. So she gave me that initial thing, saying that, okay,
Nisha.
maybe I should take ID. But slowly, then, like I said, after SITSCON, then it was all about I have to fill in the gaps, whatever I have, to make myself, become an expert and call myself an ID pharmacist, rather than, because, and I met a lot of people like Dr. Camila Rodriguez, Dr. Rajiv Soman, but none of them knew about clinical pharmacy. I was the only clinical pharmacist attending the SITSCON in 2017 at that time in Nagpur. So I could make out that, so much can be done and we have a lot of things to do. So that started off in my ID career, and then came a lot of training and things like that, which I wanted to fill in the gaps for me as well.
So what were some of the trainings that you undertook initially to maybe fill this gap?
Yeah.
So board certification was definitely a major milestone, but I'm talking about the phase before that.
See, two things I would say. That in 2017, I told you about the SITSCON thing, right? So one thing which happened before that, why I went for SITSCON now, now all of a sudden I got it. Like in 2017, there was a conference in Believers where an ID physician from the US came and talked about, stewardship and all these things. And he was a good friend of our director. So um during that time I asked him, sir, is there any way, because I can't, because we don't have role models for us to look up to, we don't know what we can actually, exactly do. So I asked him, is there any chance that, we could go and see how they are doing it there in the US? So in 2017 I went to Tufts Medical Center in Boston, Massachusetts, and that's where I did my first 1 month of training, not training as such, but observership as to how an ID pharmacist works. So we were tagged with my guide was Kirtana. So we called her Kira. So with Kira, we used to round, and the importance that she was getting, the recommendations that she was putting out, and the pharmacokinetics that she was talking about. I mean, like I said, everything went over my head, thinking that there's no possible way that we can do what she's doing here in India. Was the initial, message that I got during the training. And like I said, it was also I think that was a part chatka, saying that you need more training to work to their level. And following that, I decided to go for the SITSCON. So the first training was that perspective change. That was a paradigm shift in my perspective as to how a clinical pharmacist in a specialized area should work. So that was the first training that I got. Then the SITSCON happened. And then again, like after doing all these things, I always felt there was always so many things missing, because I'm not working with a pure ID team. I don't have people to, mentor me into that ID, because we didn't have ID physicians at that time in Believers. So that's when again I approached my director, because he was the previous director of CMC. I asked him, CMC has one of the best ID centers. They started the first DM program in ID. So I asked him, sir, is there any way that, I could go there and train there? And that's when there was a certificate course they released before starting the fellowship. Right now we know that CMC has a fellowship of clinical pharmacists, right? So before that, as a pilot to that, they started the certificate course. So I thought I'll take the certificate course and then go into the fellowship. So 6-7 months I was with I was in CMC. And again, see, I was all there to study about stewardship. But I've said this in many conferences that I wanted to know about carbapenem resistant bacteria and all these things. But when I went for the rounds, the first case that I saw was histoplasmosis, disseminated histoplasmosis. Second case was disseminated toxoplasmosis. Then see all these new things, new about fungi, about virus, about so many transplant related infections. again, these are all in a way gives you that perspective change as to how much you need to learn what were not covered in your initial years, or
Yeah.
you've not even heard about, right? So all those training, so 7 months in CMC was the actual training that I took, which really helped me in understanding ID to its depth, because I used to see consultations with my doctors that really helped in regard to how to treat diseases. So first we need to know about the disease before treating the disease. So about the disease, treating the disease, the treatment options, how the ID physician, they follow protocols for each diseases. These things I learned from CMC, and that somehow gave me confidence that slowly I should go for this board certification. Is how that transition happened. So then onwards it was always ID. There's no looking back. There's always been ID. Yeah.
So something I really wanted to highlight here is that many of the clinical pharmacists, they compare their position to the position of a clinical pharmacist, say in the US or in Australia, or all these developed or high income countries. But when you said this, what I got as a message was that, see, the clinical pharmacist in the US, they do a lot of training before they get that recognition. It's not that just after a PharmD they are given all this recognition and they are, they are on par with medical doctors. No, they do a PGY1 to PGY2. There's a lot of process that goes, there are a lot of learnings, a lot of trainings that go into that process before they actually become competent enough to become a practicing ID clinical pharmacist. So like you said as well, it's not that just maybe over a fortnight that you became an ID pharmacist. No, you did a lot of training in between. So again, I actually wanted to highlight that during this conversation as well, because it's very important that we understand we have that knowledge gap, and we need to fill that to get more opportunities and get more recognition. So I think that's very important, and thanks a lot for highlighting that as well. So that again, so you said the next step was BPS certification. So BPS is an American board certification. So what actually motivated you to, go in for BPS certification? And were there any apprehensions that you had? Okay, being a board certification, will it do any good for me when I'm practicing in India? What were your thought process back then?
Like I said, I wanted, see, basically, everything was towards that knowledge gap bridging. It was everything towards, it was nothing to do with, I felt it, I mean, I really feel that it had nothing to do with my, profession as well. But, I mean, profession as such. But if I look back, I wanted some certification. I wanted something that, I could tell the whole world that, I am trained in this, that I am a specialist in this. So that was the whole driving force towards, for me, towards taking this board certification. Because I told you, I went for an observership with Kirtana. And Kirtana was a board certified ID pharmacist, and obviously, I think, see, in from the PharmD education from India, you know that Dr. Mohammed Hisham, who's working in Cleveland Clinic, because he's in Cleveland Clinic, he has a lot of contacts, he has a lot of people to interact with, he has a lot of board certified people around him. So he took the first board certification from Abu Dhabi. So in a way that also encouraged me, because if he could do it, maybe we can also do it with a lot of training. I knew that it's not going to be easy, it's not going to be it's not going to be a cakewalk. We knew, I mean, I knew it, but I wanted to tell the world that I'm certified in this thing. And other thing why I took PharmD is because you can specialize in certain areas, right? Because you heard, I mean, initially also they were saying that after PharmD, if you want to
Yeah,
specialize in certain thing, you can specialize. So that has always stuck in my mind. And anyway, that I had chosen ID as the profession, I thought, why not specialize and just get a seal saying that, okay, I am a board certified pharmacist. So that was the initial thing that drove me towards it, towards preparing for that board certification. And I have to say that it changed my life. Board certification, I know that it can be a bit pricey to take the materials and to take the exam, but in my experience, it just turned my professional life upside down, from being nothing to all of a sudden, be being visible to a lot of people, encouraging a lot of people, and inspiring a lot of people that you can, contribute so much more with that certification. Because during the train, it's not just about that certification. Because for you to get the certification, you have to learn a lot. You have to learn all the guidelines, and that itself will, prime you to be an expert, to be called as an expert. So definitely it changed my life. So that's why I always, and I am a BPS ambassador. So the exact reason why I'm an ambassador is because I tell people how much it impacted my career, and I know that how it can impact others as well. So I always encourage people to take board certification, and we have done, as FCPI, we have done a full panel discussion with Brian Lawson, who is a BPS executive member, as to what is the process, what all things you need to do, how much years of experience, all these things are there. If Because I get a lot of requests in LinkedIn asking how to prepare for board certification. So whoever is asking, whoever is seeing this video, who's interested to take board certification, kindly go and see that panel discussion. It will give you a lot of tips as to how you can prepare yourself for the board certification if you are interested to take it.
So there'll be a lot of questions on BPS certification, but in this discussion, I think we'll skip that because we have done a whole 1.5 hour program just on BPS certification. Yes. But I'm actually interested to know what impact did BPS certification or that journey had in your clinical practice. So once you became a board certified ID pharmacist, was there any difference in the way you assessed a case, case workup, any difference in the clinical practice that you could prominently see?
100%. Yes, definitely there was. And I told you, like, this was not like a 1 or 2 year preparation, right? I graduated in 2015 and I got this job 2015 November. I graduated. I joined Believers in 2016 January. So, and I got my board certification is 2021. Okay, so from 2016 to 2021, 5 years, I've been training myself to train myself in ID. And during that, definitely the approach to case definitely changed. Because see, I can tell you, those students who would be listening to this, you can easily correlate with me. Because when you see a drug chart, okay, your mind initially goes and, okay, this doesn't seem right. Why is this written there? Is it actually needed? All these questions will come in your mind, right? So if you are a clinical pharmacist, you know that you should not use two drugs with the same mechanism of action together, right? And if you see a patient being written, okay, for some infection, ampicillin, ceftriaxone, and maybe gentamicin, something like that, you will automatically think, what nonsense is this, right? It's ampicillin plus ceftriaxone. It's two from the beta-lactam class drug. Why is it? It's absolutely irrational. Combination, right? So this is what your mind will say, as from your logic point of view, right? But when you go through the BPS certification, obviously, I told you, you have to learn the guidelines. You know that you will have to know that for Enterococcus fecalis endocarditis, the first choice of therapy is double beta lactam agent. You have to give, if it is sensitive, the combination that the guidelines suggest is ampicillin plus ceftriaxone plus, that synergy for gentamicin is the one. So always in our career, we have the tendency to say that this is irrational, this is wrong, this doesn't look good, but there's always so much more to it. Okay, and from being a student, like, we have always questioned, like, question in the sense to ourselves, not to the doctors, that this is wrong, this is wrong. But we have always wondered, oh, how come they wrote this thing? The thing is, you don't understand how the doctor thinks, right? We don't understand how they've been trained, what all things they have from their clinical practice that push them to write this specific combination or the specific practice. But when you go through the guideline, it becomes so much more easier to understand what is actually rational, what is actually irrational. All these things will come. So definitely it changed my clinical practice. Because one thing definitely I can tell you is that at least I can always, whenever I see a case, even if I don't remember the guidelines exactly, I know where to look for that specific recommendation and go back to the guideline and see whether this is like one. day before yesterday, I was teaching one of my colleagues, and it was a case of meningitis. Okay, and it turned out to be a septic meningitis. So initially, which all drugs they started slowly adding acyclovir, then slowly they took the CT or the MRI, and then they started DEXA. So when to start DEXA, whether it can be started before, after culture, based on what you give which drug, and what is the role of imaging when it comes to doing a lumbar puncture. I know that because we've learned all these things during that preparation for the board certification. I know that certain things, okay, imaging is actually required before doing a lumbar puncture, because if in certain situations, if you do a lumbar puncture, it can cause more harm to the patient. So such things, such specific life-saving things, you get to know, and you know why it is being done the way it is being done. It makes more sense to you. It helps you in giving a more, in a better tailored pharmaceutical care to your patient. So definitely it has impacted my clinical practice. And I feel that, the kinetics also, now that we know a lot of, I still feel the knowledge gap that I need to learn a lot. But, that small bit of expertise that you can say with confidence, sir, this is how it should be, this is wrong. That I can, because yesterday I had reviewed a chart where cefazolin was written 1 gram Q12H for MSSA bacteremia. I knew that it is wrong. It has to be Q8H. So just go there, talk to them with confidence, saying that, okay, this is what this is, please change. So definitely it will help. I mean, has impacted me in my professional career.
Right. And from what you're saying, I also get a feeling that the acceptance of your recommendations or your interventions might also have increased post certification, because now your clinicians also know that, okay, you are a trained ID pharmacist. You are not someone who is just guessing there, but you know the concepts, you have the knowledge, and you are competent enough to say that. So I think that also would have improved, I'm guessing.
Yeah, even at during, even at night, I get calls asking, such a patient has come, Grace, what should we give? What should be the initial empirical therapy? Shall I give this and this? What do you think? All these questions, whenever, even at night, if they have a problem, they call me and they'll ask me. And that also gives you that, okay, job satisfaction, that keeps you just being here as a
Assurance that you're doing the right thing.
yes.
And what would you say are some of the key references that you use as an ID pharmacist to update your knowledge? Could be a quick reference. What are some of the references that you use routinely? So you already told about Sanford guidelines, that which really helped you in your initial days. What others that the participants could make use of?
See, for the basics, I would, for the basics, I think there is only one book that everybody needs to learn. That is the ASHP Stewardship Guide, Pharmacist Guide to Stewardship. There is an ASHP book. That book is the most fantastic book that I've seen. So wherever, whichever conference I'm present, I mean, conference when I'm asked to take a class for the students as to how to, do the case workup and all that, it's basically about from that book that I present. And that book, if you can read, will give you that initial ID vibe. Okay, so book wise, that is the one thing that I would say. App wise, I use Sanford, and I use John Hopkins guide also. But these are both paid apps. Up to date, I don't use much for the guideline part of it, but whenever there is some dosing, this thing, if it's there, I always go to up to date. But all these three things are not free. These are all paid. But I always make sure that I have Sanford and Hopkins, so that easy, just like that, if you have a doubt, you can always go back and easily check as to what it is. And see, we can be very over enthusiastic, right? I mean, as to I have to know about all the new trials that I need to learn, but you don't know where to look for it. Like that Anytime is there, that Lancet is there, but which one will publish what? We have no idea. We know SITS is there. Uh, for that, I feel social media, the Twitter is the best way to learn. So I have an account in Twitter that is only for professional, for academic purposes. I don't follow any celebrities. I don't follow any any trending things or anything like that. It's only the ID group, the clinical pharmacy, the ACCP, ASHP, SIDP, and some of the renowned ID pharmacists and some of the renowned blogs like Contagion from SIDP. Then so many good people who, the good thing is that they all say, I mean, for me, two things. One, whenever there is a trial that is published, if it is important for you for ID, if you're following the right people, it will pop up like that. And you stay up to date with that trial with the key things as to what it suggests. Okay, you don't have to go through the whole paper unless you want to. Otherwise, you get the crutch, the crutch of the whole thing as to what that trial did and what was the conclusion, what was the recommendation out of the trial. You easily get it like that. That is the best way of updating. The second thing I felt was, see, I do not claim to be a person who is too good with the literature review, or how to assess the paper for the strength and everything. But again, in Twitter, all these discussions will come. So when a trial data comes, somebody will put up, okay, so this trial showed this, and towards the comments, if you look, there will be
Yeah.
experts commenting on, okay, this trial did not include this, or this trial was biased because of this. Therefore, this we should take, you should take it with a pinch of salt when you're trying to replicate that recommendation to your clinical practice. So you get easy expert advice based on the literatures that come, based on the recent recommendations that come from experts. So I think Twitter is the best way to learn, whichever, whether it's clinical pharmacy, ID, critical care, based on how you follow the people. If you're following them right, you will get the updated knowledge day by day. The only thing is, Twitter can be a bit much because it keeps on coming at, it doesn't, I mean, it would just go on and on. So you have to
Yeah.
choose when to do it, not on a daily basis, but maybe on a weekly basis,
Yeah.
something that will help you to update your
Yeah.
knowledge.
I completely resonate with that. And I came to Twitter quite late. I also got to know from a physician who is working here that Twitter is the best platform for you to learn. And that's how I got an account in Twitter. And like you said, Twitter can at times be a bit overwhelming if you don't follow the right people. So when you become too over enthusiastic and you go and follow hundreds of people, you get an overload of information, and then you can get a bit overwhelmed there. So when you start a Twitter account, make sure that you follow the right people whom you think are the best people to give you the information that you need. So that kind of a filter needs to happen. And once you know whom to follow and you're following the right people, I think Twitter is an amazing platform if you use it right.
Yes.
So another thing that actually you mentioned during the discussion was your interest to go for SITSCon. And I know that you are one of the very few clinical pharmacists from India who is very, what do you say, punctual at SITSCon conferences. I don't think you have missed any SITSCon from 2017. And I also know that you have a lot of connections or networks among ID physicians, ID pharmacists, not just from India, but also from abroad. So what do you think is the importance of having this kind of a networking, and how has it impacted your career? Because I got to know the importance of networking only after I started working in an international project and I got to interact with international experts. That's when I understood, okay, there's a lot to learn from them and they are actually very willing to teach us. It's only when I started working there. Now I know the importance of networking and I try to network with as many people as possible when we go for conferences as well. But I think you got into the game before me, maybe. It's been few years that you understood the importance of networking. So what can you share about that experience?
I did miss the SITSCon in 2018 because of the Kerala floods, because all the trains and flights were cancelled. I couldn't go to CMC. But yes, like you said, I make it a point to make sure that I attend the SITSCon because it's like, a year in a wrap. You get every information that you need. Even if you're lazy for one whole year, if you go to that conference, you get updated knowledge. And the best part for me regarding SITSCon is that it's everything is in that Indian context, because all the recommendations that come are the international one, and how these clinicians they put the Indian context into it so that it's easy for you to practice. So that's why I go to SITSCON. And like you said, I had the something I never thought would happen, was that, see, we always look, up to our uh, physicians. Like for me, the ID physicians, the top people in the country, we always look up to them, learn from them. And it's their society. It's their society. And never in my life, I mean, so far, I thought that, I would ever become a faculty for SITSCON. And that happened. Brinda, you were also there last year when three of us were, serving as faculty for, the Clinical Infectious Disease Society, which I felt is one of the proudest moment for
Yes,
me.
milestones.
Yes, yes, one of the biggest milestones. I never thought it would happen, because we know that doctors, they try, I mean, not purposefully, but they have their own group.
Close network.
Yeah, so they try to do things within themselves. So therefore, getting into, like I said, in 2017, there was not even a single clinical pharmacist other than me. But last year, Brinda, you also know that how many clinical pharmacists came to
Yeah.
SITSCON. More than 20, I would say. I think more than 20 people were there as clinical pharmacists attending SITSCON. So for any specialty, not just ID, getting into that uh, professional groups help you to network with the experts in the country. And for me, if you ask me the international one, see, like I told you, how board certification impacted me. I think board certification was the key that gave me the ambassadorship to the Society of Healthcare Epidemiology for America, SHIA. So that was the second major thing that happened to my profession, that I went for the SHIA conference in Colorado. And I get to know a lot of people, right from Nigeria to Argentina, from Spain, from UK, from Australia, from everywhere across the globe, people came. And you could see the benefit of being from India is also there. Being a low to middle income country, people are there trying to help you. Okay, they genuinely want to help you, because they feel that, it's like something that gives them pleasure in helping a poor country. So many people are there actually, looking forward to help us, selflessly help us, without thinking that what they will get out of us. So such networks. And during that SHIA conference, I had the opportunity to go to the Detroit Medical Center, which is in Michigan, in Detroit. And there I worked with Dr. P.H. Chandrasekhar. And Dr. P.H. Chandrasekhar is one of the pioneers who started ID in India. So I went with him for rounds for 1 month. And the 2017, the Boston one, when I went there and everything was going over my head, this time they asked me what my recommendation was when going for rounds. And I could tell them,
Right,
in
right,
US, in US, I could tell them, this is what I would do. So that is the impact, throughout this career that has happened. And I always say this, in 2017 versus 2022, in that 5 years, a lot of things happened, and a lot of things helped you to become that expert. And again, having to know Dr. Chandrasekhar, Dr. Payal Patel, Trisha Patel, Dr. Jesse, we had the first ID Congress in Believers. We invited them because that was the networking we had. And we know that, the ID Congress gave a lot of importance. The first ID Congress, we had around 1,000 delegates. We had a lot of physicians who were coming, a lot of medical trainees who were coming for the conference. And that really gave the clinical pharmacy a push, right? It really, that uptrend was there when a lot of activities started to happen. So definitely collaborations and having them come over, share their experience, having collaborative efforts really propel not just the career, but this whole field of clinical pharmacy. So if, like in ID, what happened, if such similar things can happen in transplant, in critical care, in cardiology, in ambulatory care, just imagine how we will reach, how fast we will reach to our goals, where clinical pharmacists being one of the prime members in the team. That will happen if these networking can go right.
So, what are some of the key learnings from your experience so far that you impart to your mentees? So, I'm sure there is a lot. There are lots of students, a lot of clinical pharmacists who come to you for advice, who ask you questions, and who need your guidance to excel in their career. So, What are some of the key points that you share with them?
Uh, Advices, if you ask me, I mean, I the first thing that always comes to my mind is staying humble enough to know that you can be wrong anytime is the first thing that I would say. So I get a lot of students who come to me and say that, my doctor, he doesn't do this, he doesn't do that. Very biased, especially students can be extremely biased when it comes to clinical decisions. And my way out of it is, I'm not an aggressive person. I'm not an aggressive person in the sense I don't go and say, Doctor, sir, you're wrong. I never do that. Okay. I try to put myself in their shoes and I try to think as to why they came up with that combination, which everybody thinks is irrational, as to what is it that scares them to, take off one or of that irrational combination or that drug, or not going with the recommendation. I try to justify them as much as possible. And only if I can't justify them in any way, I go and tell them, sir, this is something like this. Can we try this? See, it's always uh, partnering, because the primary care of the patient is always with the doctor. And we are not responsible. Like recently, I had an incident where, I had to be firm with one of the doctors when I said that, and one of the senior most person who is a retired person who was not willing to change what he has written. And he even asks that question, okay, will you be answerable to the patient? Yes, this is the question that he asked me, because obviously that is the way they will tackle us, right? If
Yeah, yeah. They are the face of patient care.
yes, so this time I decided I'll step up and I'll say, yes, sir, I will take the responsibility. If you want, I can go and talk to the patient. Then he got scared. He said, no, no, no. Okay. You don't have to go and talk to the patient. Okay, let me see, because they are, that daughter is a nurse. She would know, and he knows that if I go and talk to the daughter, he'll be in trouble. So then he withdrew and stuck to the recommendation that we gave. But seldom that happens that I go and say you're wrong. No, this is no. You don't take that liberty with the doctors. You respect their decision and you try and justify them as much as possible. Is something that always helped me in. See, the reason why here in Believers we have these many people is only because of the doctor support. It's not because we are great. It's because the doctors are allowing us to grow, allowing us. They are teaching. They are willing to teach us to get into the whole thing. So without their support, we won't be able to do anything. So I always have that in the back of my mind, and I always try to be as friendly as possible, as good as possible to them, and try and help them anytime they want a favor. I always They always ask me freely that whether I can help them out. So this is how you slowly build up your relation, so that slowly they'll also start supporting you back, is what I had learned. That is the biggest lesson I think from the career so far that I know. Knowing that you can be wrong, and to be gentle, but when needed you have to be firm, but
Yeah.
try as gentle as possible with your doctors.
I think those are some of the key skills that any clinical pharmacist, not just ID pharmacist, any clinical pharmacist need to have. Like they need to understand the importance of effective communication. So when they are speaking to the doctor, make sure that they are not questioning their autonomy, prescribing autonomy, because even now that kind of behavior is there, that doctors are the superior ones, they are the decision makers. So they, at no point they should have a feeling that you are questioning their judgment. Then that creates a lot of friction, unnecessary friction. But rather than that, if you talk to them in a very effective manner and make it a point to bring it to their notice that you're trying to help them out and to improve patient care and not to question their decisions, I think that makes a huge difference about the way in which they approach the clinical pharmacist, as well as uh, that builds a lot of trust in them, and that opens a lot of opportunities for clinical pharmacists. So I think that's a very, very important skill that we need to have. And like you said, there should be a balance. So it's not that always you feel, okay, doctors are the right ones, so I might be wrong, so I should not talk to them. No, that's not the case. You need to understand the balance, and where you feel strong enough, confident enough that, okay, I need to step up and speak, you need to. but it should be in an effective manner that doesn't offend the other person. It doesn't, seem like, you're pushing or thrusting your input onto them. So I think that fine balance is very important for us as clinical pharmacists. So I think we are coming to the end of this very, very interesting discussion, and I want to move into a bit of an interesting kind of a segment. I wouldn't call it rapid fire, but I would rather call it quick fire questions, where I am going to ask you a few questions about certain moments in your life. Whatever comes to your mind first, you can talk about that very briefly, very quickly, whatever comes to your mind. So the first thing is, ultimately, for any clinical pharmacist, the ultimate job is improving patient care. So any moment from your career where a patient has come to you and appreciated your work and you felt that, okay, you are doing great.
One of our, again, this is a gastro patient, but she had an infectious problem. So she was a recipient of a liver transplant 3-4 years ago. And while we were taking our night rounds for this patient, I felt that the patient was not breathing normally. Okay, that was the only finding that, during the rounds, because it was just actually a social visit just to make sure, hi, hello, how are you? And during that time, I felt that she was using her accessory muscles to breathe. And I told the sister, please, Sister Ji, please get me the pulse oximeter. And when I took the pulse oximeter and I put it on her hand, it was showing 72. The saturation was only 72. So immediately, you know, uh, shifted the patient to the ICU. And I was trying and telling the doctor as to, that, this is a sudden collapse. All of a sudden she had, and she's a recipient of the transplant. And I think the X-ray and the CT was taken. So much of ground glass opacities and things like that. And we thought, yeah, it could be this pneumocystic pneumonia, this PCP pneumonia.
Yeah.
And that was correct, actually. All of a sudden she just desaturated, and it was PCP was actually the reason we put her on Septran. Then she went into AKI. Then we had to change the drugs again to Clinda and the other antifungal for PCP. And I remember this very well because when you ask just like that, when it comes to patient care, the appreciation that I received from not just from the patient as such, but because I was very close to the patient's family, and just not just from the patient's family, my critical care consultant and uh, my gastroenterologist, they were very shocked to see that such a, and that too it was at night. If we would have missed that at night, if she stayed there till the morning, she could have easily gone into a cardiac arrest because of the desaturation. She would have gone into shock. All these things should have could have happened. So for me, they were like, oh, how did you know all these things? You literally saved this patient. And while I was talking to the critical care consultant as to this thing happened, this is why she's here, one of my neurosurgeons, he was standing next to me for some other briefing for an ICU patient. And he went to my director was there with me at that time, because we went both for the rounds at night. So during that time, this neurosurgeon went and asked my director, how does she know all these things? And he came and told me. That was really, so uplifting for me, that, all of a sudden we could save that patient's life. And as well as an ID person, you could pitch in as to
Yeah.
being a transplant patient, how it was.
Amazing. So you have a lot of accolades to your credit in your career so far, but what is it that you consider as your biggest achievement so far?
I think it has to be the board certification, because I think for one major reason is that the reason why I feel proud is that I feel I could inspire a lot of students, a lot of people who are trying to, as to how can we do it. So for them to, for me to show them a path that it can be done, uh, that gives me that, that proud feeling that, okay, in a way I could pave some way for, the budding clinical pharmacists to come if they are interested in that part. And I told you, from there onwards, it has been a very steep this thing for me, from She Ambassador to VPS Ambassador, all these collaborations. So I obviously
That was a
consider
starting point.
as one of the major things.
Excellent. So, what is the best lesson that you have received throughout your career? So, it could be right from the time you were a pharmacy student, then as a clinical pharmacist, ID pharmacist. But what is that one thing that you always carry with you as the biggest lesson learned?
Oh, for a rapid fire, that's a difficult
But anything that pops in your mind
Not
right
that
now.
somebody told me that, but I always encourage people to stick with one person that can uplift your journey in a tremendous way. You know, if you have the right mentor, everything will fall in its place. For me, it's my
Very
director.
true.
It's my director. I tell him that if you were not there for me, I would have still be the only clinical pharmacist working in believers, just doing their NABH work and all the ordinary ADR monitoring and medication error. Only those things. I would have just confined myself to all those things. It's just that finding that right person, even if your salary is low, it doesn't matter, because the right person can help you in your growth in a very different trajectory altogether. So I think that is the biggest lesson that I've learned, to find the right person and stay with them, so that you get, you it's a mutual relation. You give whatever you can give to them, and you get whatever professional advice and everything that you receive. And he is one of the greatest leaders that I've seen. So I've learned a lot about leadership also from him.
I think that's an amazing lesson, and that's a discussion for a whole another podcast. The role of
You yourself
mentorship,
would
and
know, because you've been with Dr. Sanjeev Singh, right?
yeah,
So
exactly.
how exactly it is to have the right person in your life, so that
Absolutely. Yeah, that's what I said. We don't have the right time to discuss in depth about that, but I think that's a topic for another podcast altogether. Okay, moving on. Your biggest inspiration in clinical pharmacy and why?
like I told you initially, because you are the second batch, you don't have many people to look up to in India, and obviously you don't know the people abroad to be your ideal role model. So obviously it is Mohammed Hisham, because he has been an inspiration throughout, and his consistency is something that I've always, he's always consistent. He's always serious about what he's talking about when it comes to the clinical practice. He's very serious about what he's saying. He never takes anything lightly. And he obviously did show me the way that board certification can be taken, even if you did your PharmD from India. And he never ceased to inspire me. From one thing to the other, he is just an amazing person that I always look up to.
I think a lot of people who are listening to the podcast right now would resonate 100% with you on that. Okay, your proudest moment as a mentor.
Proudest moment as a mentor. See, when you have a lot of people coming to you and try and learn from you, and whenever a person that you taught go elsewhere and do a great job and get the accolades, that's when you feel proud that I had a part in teaching them. So I had a couple of people like that who had actually, they were so bright, and going to other places, they have lived there, they have paved the way for others as well. So definitely I have two three people, which again would be a lengthy one if I tell name by name. So yes, definitely, when whom you are training, they're just going and uh, paving the way for others, is the proudest moment for you as the mentor for them.
Absolutely. All right. So the last few questions for the podcast is on future steps and scope for clinical pharmacy in India. So I would start with asking you, what are your future steps? So when you go to an industry, there's always a hierarchy. Like, you have promotions, you go from one to the other, to the other, to the other. There is a next step always. But a major, I wouldn't say criticism, but a major thing that everyone talks about clinical pharmacy is that once you're a clinical pharmacist, you remain as a clinical pharmacist throughout. There is no such kind of grading and things like that. So now you're an ID pharmacist. You are a member of the hospital administration team. What is your next step?
Mm, that definitely, see, initially when you take the career, these things never come to your mind, right? But once you get into the career, 1 2 years into your career, you slowly start to think yourself as to where am I going, what all things can be possible for you. But right now, I do a lot of administrative work, and majority of my work is towards administration, towards pharmacy, clinical pharmacy. Uh, there are a lot of things. See, it's all about having that leader. I mean, I'm not saying I'm a great leader or anything, but if you're, in your initial few years, if you prove that you are a trustworthy person, that you're a capable person, all these positions can come to you as well. Because if you look at, especially in pharmacy, I can tell you with so much confidence, is because if you look at the top CEOs in and around this country, a lot of them are pharmacists from the pharmacy background who are doing well as directors, as CEO. So why not a clinical pharmacist, right? So if you
Absolutely.
have the right mentality towards working hard in the initial years, and you give that confidence that you can be entrusted with a certain task and you'll do good about, I mean, you have your own ways of getting it done. I think slowly that opens up your leadership board as well. And definitely, once you are in the administration, it's very different from the clinical practice. You get to take decisions. You get to change. For me, you know, if I tell them, let's build one more pharmacy here so that the patients can be sent off in a, in a faster way, they are willing to take that into implementation. They are building a pharmacy. So all these things again add on to your career. So definitely, see, as and when we are progressing, right? As and when we are, because even now, my experience is 8 years. So far I have only 8 years of experience. That's not too much, right? It's never too much. It's just a little bit of experience when you compare with people with 40 years of experience, 50 years of experience. So there's a long way for us to go, and that doesn't mean that I'm going to stay here as such for the next 40 years of my life. It's not going to be like that. There will be opportunities, but it needs to be explored a bit more. But I feel leadership is something that easily we'll be able to do if you can show that skill to the right person. And regarding what my future plan, obviously I told you, right? I always feel that inadequacy in knowledge gap or things like that. So I feel that transplant is something, again, I need to learn a lot about in academic point of view. But if you actually ask me how my career would grow, something that I'm really really interested would be, which I have not conquered or encroached into, is the clinical research part of it, the quantitative research, getting to know better as to how we can do better with related to ID itself. And definitely that would be my line of thought, along with the administration from the clinical. Yes.
Amazing. And my last and very final question is, as a leader in clinical pharmacy in India, what do you think? What do you think is the way forward for clinical pharmacists? How do you think clinical pharmacists in India can improve their recognition and take things forward?
Again, like I mentioned regarding the professional bodies, as to how, like, each of us who are in clinical pharmacy, if you are, see, the thing about clinical pharmacists is that we are passionate about it. See, why not go to an industry where you are getting paid more, and why stick to the clinical practice? Because it's a passion that holds us here, right? So getting into the professional societies is definitely one of the way in which we can advance our career as such. Just the clinical pharmacy fraternity advancement can happen with the professional body inclusion. If the doctors start to acknowledge us, because already it is happening, it's only that we take it to the next level. Therefore, definitely, one is that. Then you asked me regarding how to take
Way
it forward
forward for clinical pharmacy.
for clinical pharmacy. Then again, the other thing is regarding, molding our own fraternity. See, that is what, in a way, FCPI is also doing, right?
Absolutely.
We are all here because we have learned it the hard way. Okay, it took years for us to train the way we are right now, and we don't want our budding people to, struggle as much as we did. So we have to make our own our own field, our own clinical pharmacy community much more equipped, drive them into excellence, so that we are considered an integral part of the care team. There's so much that we can do, and being an FCPI, being from FCPI, I can say that with so much confidence that that's exactly what we are trying to do. Apart from our professional busy lives, we are setting aside time so that the next generation can learn a lot from us. Don't make the same mistakes that we did, and help yourself grow in a much faster pace is what. So giving back to the community, making sure that we reach the excellence, that also will really drive our clinical pharmacy profession to the next level. And I know that definitely in the future there'll be a lot of people who will take board certification, and doctors also will see the value. Okay, it's not just about like feeling that you're a specialist. The monetary value also, because doctors will fight for you. If they feel that you're valuable, they will fight for your salary, they will fight for all these things. So I think that way also, getting more specialized, getting more into the clinical practice, and being an expert in pharmacokinetics and things like that definitely will drive our profession to the next level.
Amazing. So I think we have to wind up our this very, very, very interesting discussion. I think we can go for hours and hours, but we've already exceeded our time limit. So thank you so much, Grace, for all the valuable insights that you shared during the discussion. And thank you to each one of you who is listening to this podcast on a Saturday evening. So thanks a lot for supporting all FCPI initiatives. We would really love to hear your key takeaway messages from this discussion. So do feel free to post your learnings from the podcast on social media and tag us. And we would love to give you more content on this. And hopefully, clinical pharmacists from India will thrive in the future. And we are very grateful to have leaders like Grace to lead the path. So thank you all and have an amazing weekend. And I think we'll wind up. All right. Bye-bye.
Thank you so much, Vrinda, for this opportunity, and for FCPI for giving this inspiring thing so that people can learn from our experience as well. So thank you so much. Good night to everyone.